So welcome to today's podcast, East Meets West, Good Friends, Good Medicine. My name is Dr. Tom Rowley, joining you from Mullumbimby in northern New South Wales, Australia. I'm joined by my longtime good friend, TJ Frank. TJ, how you doing?
I'm very well, Tom. Aloha. Good to see you.
Aloha. Where are you at, and what are you up to in your work life?
In my work life, well, I have a private clinic where I see people about 4 days a week. I teach at a massage school in the methods of shiatsu. I teach qigong privately and publicly at a Healing Wellness Center in Wailea. And I work at a drug alcohol rehabilitation facility for those in acute detox. That's most of it in the professional. And then I do these talks with you to demonstrate to the world how well the Western and Eastern models come together and how it could provide a mutually beneficial environment for care providers, economically cutting the cost of care and better outcomes for clients. And then on the side, I have a family and I farm trees and vegetables.
Right, I love the trees and vegetables and the family. It does balance out the life to a degree. So,
yeah,
good stuff. Actually, if you like this podcast or you're watching, then you can subscribe on iTunes or Stitcher or on YouTube. And we're actually up to episode 10. You believe that?
Whoop, whoop.
This is going well. Is there 10 episodes in? And today's topic, premenstrual disorder, premenstrual syndrome from the Western diagnostics or diagnosis. And might jump in and give you a little bit of a rundown about how I see this topic. Does that sound?
Great.
All right, let's So it's interesting. So the actual diagnosis. So I got two main diagnoses. One is premenstrual syndrome, and the more severe form, premenstrual dysphoric disorder. And it looks like it's around epidemiology. 3 to 8% of women would suffer from the criteria of premenstrual syndrome, and then maybe another 1 to 2% with the more severe dysphoric disorder. So in terms of working out what's going on, the classic features for me are that typically starts in the 20s for women and will continue on through their life if it's untreated. And the main feature is that the symptoms have to present in the second half of the menstrual cycle. And then typically will get better as the menses comes in. To actually make the diagnosis for either of these, there needs to be some level of dysfunction, some level of economic or social dysfunction, not just the symptoms themselves. It has to cause impairment. And there's three main categories of symptoms. One is affective or emotional symptoms. The next one is physical, and last one's behavioral. So the things around the emotional, the affective symptoms, so that depression, the classic is mood swings, anxiety, irritability. So they kind of be the main emotional experience of premenstrual syndrome. And then in terms of physical, things like breast pain, bloating of the abdomen, headache, and interestingly, hot flushes. So if it's hot flushes that occur at that time of the cycle, but they're not perimenopausal, they're not menopausal, and they're not pregnant, then that would be a classic sign for the disorder. And then behavioral, interesting. So food cravings could happen, marked fatigue can happen, and then some kind of impaired focus or disinterest in usual activities. So that's kind of, there is a massive long list of features that are described, but they're the main ones that would be experienced by women for the actual for the premenstrual syndrome. And for the differentiation between premenstrual syndrome versus premenstrual dysphoric disorder, so the premenstrual dysphoric disorder is the more severe one, And basically, if there's 1 to 4 symptoms of those, then that's premenstrual syndrome. If there's 5 or more, but there's no emotional aspect, then that would still be premenstrual syndrome. But if there's 5 or more symptoms, and there's 1 or more affective symptoms, then that makes it into premenstrual dysphoric disorder. And one of the key bits around the dysphoric disorder is actually checking in around suicidality. So we want to make sure that there's no suicidal ideation at that point. So that's really an interesting that it's quite severe. I'll also bring in at this point that it is possible to make the diagnosis even if women aren't having the actual bleeding, their cyclical bleeding, because of either, say, a hysterectomy where they've left the ovaries, or if they've got an intrauterine device such as Mirena, which releases low-dose progesterone and actually prevents many women will end up with amenorrhea at that point, so no periods. Now, to make the diagnosis at that point, you'd be looking at that cyclical recurrence at 28 to 35 days of these symptoms, even though there's no actual blood flow. So that would still make the diagnosis. Dropping in on a couple of, there's no specific examination findings on physical examination. And really, from an investigation point of view, it's just mainly ruling out thyroid disorders. Is there thyroid problems? So a TSH. The other differentials would be anxiety or depression, but these would be consistent throughout the entire menstrual cycle, or possibly some level of alcohol abuse, possibly as another differential. What else I got? I got some interesting stuff around the pathophysiology. So it appears that the actual sex steroids, so the progesterone and the estrogen, are required for the disorder, but not sufficient. So there's no actual difference with women who have these problems and women who don't in terms of their actual cycling of their hormones. But if you take them away, then they don't get the symptoms. But what we think is that there's somehow the sex steroids affect neurotransmitters because and this would be largely around serotonin in the brain. So decreasing serotonin in the brain is some part of the disorder. And that's shown in some interesting studies where the women with it will have lower blood serotonin. And also, if we deplete tryptophan, which is the precursor to serotonin, then symptoms will get worse. So that's what I got from around these two disorders. And interesting how you see this, TJ.
Right on. Thanks, Tom. Appreciate that bit of additional pathophysiology around the serotonin. From a Chinese medicine perspective, this is a gynecological disorder, and therefore the menses has to be a particular phase of premenstrual. So we break menstruation down into 4 phases: the menstrual, the postmenstrual phase, the middle or ovulatory phase, and the premenstrual phase. So the menstruation is approximately 5 to 6 days in length, and each of the subsequent are 7 days in length, adding up to a total of 26, 28 days on average for a regular cycle. So premenstrual symptoms are those that happen in a 7-day window previous to menstruation. So rather than 15 days, for us it would just be the 7 days in advance is the period. It's important to understand the 4 phases. Chinese medicine, one builds upon each other in a cycle. So if the first stage being menstruation, if there's a lot of heat or a lot of stagnation, it leads to disharmony in the second stage. The second stage, being the postmenstrual stage, is when the body has been depleted of blood and qi, and the body needs to replenish itself. This is when the estrogen comes up, and the luteal lining builds, and it's the nourishment phase. If that nourishment phase doesn't go well, if that that second stage in the cycle, the post-menstrual phase, if there's not enough buildup, it'll lead to subsequent premenstrual symptoms in the 7 days in advance of the menstruation because there wasn't enough blood to build up for discharge, and it leads to stagnation. So each of the different phases have a different effect. The middle phase, ovulatory, the middle phase, let me get it in specific. During this phase, the yin and blood both build up. The ovulatory follicles develop under the luteinizing hormone. This is a phase of rest where we don't use much intervention. And then the premenstrual phase is an interesting period where the yang hormones build. The blood from the liver goes down into what's called the bai mao, which we say in Chinese medicine, the blood for menstruation comes from the liver down to the uterus through a specific vessel. It could be either thought of as the descending aorta or the hepatic portal vein system that connects the blood up. There's a blood connection from the liver down into the guts, and the blood in the fourth phase, the premenstrual phase, gets activated by yang and is brought down to the liver. So just as an overview, once again, for the menstrual phase, the entire menstrual cycle in Chinese medicine, the first, the menstrual, is where the blood is released. The second, the blood builds. The third, it rests and fills. And the fourth, it drains. This makes sense ecologically?
Yep. Yeah, right. Interesting. Yeah. So the draining is not the release. It's a dropping from the liver down into the womb and then into
the womb. In those few days before menstruation, is when the liver blood releases. So if the liver's hot, if the liver's stagnant, or if the liver doesn't have enough blood, or there's not enough yang qi available to move the blood, the menstruation cannot occur smoothly. There'll be all sorts of menstrual symptoms, as well as PMS. So to qualify for PMS, it's symptoms of primarily irritability in that 7-day period previous to menstruation. Now, that being said, kind of like how you and I were talking about earlier, the list associated of symptoms to PMS is quite broad. Depression, sadness, irritability, anxiety, lethargy, loss of consciousness, aggressiveness, change in libido, child habit, interruptions, food cravings, crying, outbursts of anger, clumsiness, distension of the abdomen and breasts, insomnia. And in severe cases, it can lead to even injury of family members. Which in the Chinese text, it's interesting they include that. So for us, there's no cardinal signs per se, it's a conglomerate of signs. And when we get into the differentiation of syndromes, you'll see different syndromes have different symptoms. So that's PMS at large and when it occurs and the overall physiology of menstruation from the Chinese medicine perspective. The beginning of menstruation, there's a lot of yin activity. The nourishment of blood and fluids. The end of menstruation is a lot of yang activity, the warming of blood, disbursement of blood, and the releasing of heat. There's a yin-yang throughout menstruation. The estrogen is considered the yin hormones, and the progesterone is considered the yang hormones.
Okay, interesting.
Just as a bridge between east and west. So now, once again, in differentiating Chinese medicine, we use the 8 principles. Is this an excess, deficiency, interior, exterior, yin and yang, hot or cold? The first one's the most important. Is this a full condition or is this an excess condition? The 2 syndromes you've outlined thus far are our 2 full or excess conditions. The 2 full excess conditions are liver qi stagnation with yang flaring up, just liver qi stagnation. And if there's enough liver qi stagnation to create fire, while in the presence of dampness and phlegm, then the phlegm and the fire both disperse up. And that provides the breast distension. And the Chinese are interesting. They don't think consciousness exists in the mind. They think it's in the body. And they've broken down consciousness into 6 parts that exist in 6 different organs. Hon, Po, Ling, Zhi, Shen, Po. Did I get that right?
Yeah.
Poem is po, e, sure. I have to look it up. And shen. Shen's in the head. Shen's the heart. The heart is the mind link. And if the phlegm comes up, it disperses the mind, and that's when they get really irritable to the point of psychotic. So, and this just liver qi stagnation leads to the irritability. If that develops into fire in the presence of phlegm, then it creates the second syndrome, where there's a 5 or 6 of the symptoms plus emotional upset.
That's cool.
All right, so those are the 2 excess. Liver qi stagnation. Yeah, liver qi stagnation, phlegm, fire, ascending. And now there's 3 deficiency ones as well. The deficiency ones aren't going to have the strongest symptoms. Liver blood deficiency, liver and kidney yin deficiency, and spleen and kidney yang deficiency. Those are the 3 deficient ones that cause PMS. So liver blood deficiency, like I said, in that second phase of menstruation, the post-menstrual phase, when we're supposed to be resting and tonifying the blood, if we work and engage in sports and fast and only eat salads to lose weight or do any of that, we're not going to nourish enough blood. And then we could have liver blood deficiency and get PMS because of a maladaptive lifestyle or behavior in the beginning of the menstrual phase. So the first deficiency is liver blood deficiency. The next one is kidney and liver yin deficiency, because it's the kidney and liver yin that builds blood. And then the last one is the spleen and kidney yang shu. Like I said, in the 4th phase, the premenstrual phase, we need yang qi to lift and disperse the blood so that it can be discharged. All right, so that's the exact differentiation with the loose description of the pathophysiology around each of them. The cardinal signs for the liver qi stagnation is going to be a wiry pulse, a tight tongue with a quiver, some irritability, some emotional upset. The pulse is going to be really wiry. They'll usually have wrinkle lines in the front between their eyebrows, maybe wearing green and talking about anger and frustration. If it gets to phlegm fire excess, they're going to have a bulging red tongue. They're going to be puffy and swollen, breast distension, gurgly voice, restless dreams, irrational behavior, irrational outbursts. This is when there's a phlegm component obstructing the mind. In the first case, liver qi stagnation, free.
Yep.
In the next case, free the liver qi, quell liver fire, drain damp, and harmonize the digestion. Digestion leads to dampness. The deficiency ones, liver blood deficiency, so they're going to have a pale tongue, a weak pulse, distending migraine or headache behind the eyes, worse before menstruation and during menstruation, distending hollowness, floaters, thin brittle hair or hair that falls out. These are the liver blood deficient people. Tonify the liver blood, free liver qi stagnation. Kidney and liver yin shu, they're going to have ear ringing, night sweat, sweaty hands and feet, dry skin like a raisin, dry tendons, history of tendon disorders or tears, a thin branch that easily gets snapped in the wind. That's the kidney liver yin shu type. They're going to have hair that's not falling out, but it's white or gray, pre-graying of the hair. Especially around the pubis, that reflects the blood in that area. And then lastly, the spleen and kidney yang shu folks, they're going to have, these are the ones that are weepy before, depression with weepiness before menstruation. They can't stop crying. Leukorrheic discharge, pale, puffy, bloated tongue, digestion problems such as daybreak diarrhea, as we've spoke about in the past, and undigested in the stool. Aversion to cold and a feeling of cold sensation, and menstrual blood that's clear and blue, bluish in color. The liver qi stagnation people will have clots of a normal color. The phlegm damp heat will have thicker red, hot red clots, sticky clots. The blood deficiency will have very scanty menstruation without many clots. The kidney liver yin shu will also have scanty but bright red blood. And as I mentioned, the spleen, yang, kidney, qi deficient, or yang deficient group, sorry, they're blue, purple, watery blood. So by examining the color of the blood and the viscosity of the blood, it also helps establish the differentiation.
It's really interesting to me when I was going through this, for me, like looking at the irritability and the anger, and then also to having the same syndrome, like, well, from my perspective, the sadness. It's like, what? How can that? But when you break it down, it's like, oh, that's actually two different phenomena. Like, there's a different underlying root for people who are sad beforehand all of a sudden versus the ones that are angry. Even though both are classified within the premenstrual disorder from a Western perspective. That's quite interesting.
Yeah.
Really cool.
Yeah, emotionally, there's gradients in the excess from just angry to psychotic. And then in the deficiency characteristics, the other three differentiations, they're not going to be so fiery and loaded. They're going to be more deficient, withdrawn, depressed, sad, weepy. There are also PMS symptoms, but they're indicative of a deficiency root in this particular syndrome than an excess root.
That's cool. That's cool. Well, that's interesting. Well, why don't we move to treatment and what it's bringing up for me? One of the treatments that, again, don't work that well may well be reflecting different causations, even though I've grouped them all in one thing. It's quite interesting. Why don't we have a look at that? There's my notes. All right, cool. So we've got a couple of the most effective probably is the serotonin selective serotonin reuptake inhibitors. So basically, these drugs go in the brain and make the serotonin last longer when the nerve conduction happens. So the nerve fires, the serotonin pops out, and the drug is binding at the protein that takes that serotonin and puts it back in the nerve cells. So the serotonin effect lasts longer. So these are the kind of Prozac drugs essentially, and there's a number of them: fluoxetine, sertraline, paroxetine, citalopram. And the interesting is it's sort of the general advice: start low, dose, and increase it to effectiveness. But the effectiveness of this, around 60 to 70% of women will respond, and they should expect a response within that next cycle. So that if there's no effect, then it's rapidly known about. There's a couple of different ways that were sort of spoken about using this. So one is continuously throughout the month, and this would be for women who have some level of symptoms, even when even when they're not premenstrual, that there's still some level of symptoms. So that would be a continuous regime. But they speak about two other ones. One is the luteal usage only. So as the second 2 weeks of the cycle, they start at day 14 or day 15. So we count day 1 as the beginning of menses as well, and using it for the second 2 weeks. And also then one more methodology is at the beginning of symptoms. So this would be a symptomatic usage. So that as soon as they start getting symptoms, if they can recognize them clearly, then we take the medication. One of the interesting things for me around the way of using this is the general experience or the recommendation when it's used in depression or anxiety. These drugs are also used in those. Is that it's thought to take some time before the medication has its effectiveness. So 2-3 weeks is classically spoken about, and so very interesting to see that in the premenstrual syndrome or premenstrual dysphoric disorder, that they're still effective even if they're just used for either say 5 days or 14 days, depending on the methodology, which would seem to contradict that other advice that you have to wait 3 weeks for the depression, unless it takes some time for its effectiveness in depression to actually overcome the symptoms. So 30%, anyway, that 30% of women not responding, the next choice would be overriding the hormonal system, and that would be oral contraceptive pills. It seems like the most effective ones are a particular progesterone called drospiridone. Its main risk is an increase in venous thromboembolism, so you need to be aware of that. Can't use it in women with risks of venous thromboembolism, but nonetheless quite effective. Basically, decreasing perhaps the cyclical nature of the sex hormones, and therefore not triggering the serotonin deficiency or the serotonin problems. Beneficial might be considering a decreased amount of pill-free days. So the classic usage of the oral contraceptive pill would be 21 days of active hormone and then 7 days of no hormone. But consideration to go to, say, 24 and 3 days, or even continuous usage. The problem with continuous usage is eventually they will usually get spotting, which is found to be very frustrating by most women, and they do not like it. But they might have to have withdrawal bleed every 3 or 4 months. Beyond that, we get into some fairly heavy-duty treatments, and I'll mention them just for completeness. The first one is gonadotrophin receptor hormone agonists, and this is basically blocking steroid, estrogen and progesterone totally. And then the problem with doing that is that you'll likely induce menopausal symptoms and decrease their bone mineral density, putting them at risk of osteoporosis in the future. So they speak about putting add-back hormones. So it's like suppress and then add back and provide a consistent hormone experience through the entire month. And then if it was absolutely intractable, then you have an option for a surgery. You bet. So we can cut out the ovaries. Done, you know. Intractable cases, hopefully we can have some kind of usage to avoid that. Actually, the other recommendations across any of these is for exercise. Exercise would be beneficial, walking, and also stress reduction and relaxation techniques. So these also, while not having any formal clinical, they haven't shown to be effective in studies but it's thought to be good advice for these people, for these women, and so therefore exercise, stress reduction, relaxation, meditation, all worthwhile. Last thing to mention, if there is suicidal ideation from those women with premenstrual dysphoric disorder, then we'll look to have psychiatric evaluation and then their input and making sure that they're managed well. Yeah. Oh, I better mention one more thing. Side effects of the selective serotonin reuptake inhibitors. Common side effects of Prozac would be nausea and headache and insomnia, which they might have already. But the one that I've got to warn patients about is the decrease in sexual libido and sexual dysfunction. So somehow it's affecting the sex drive for these women, and so I need to warn them about that. But that's pretty much what I got, and yeah, interested to hear what you have from your perspective.
Right on. Thanks, Tom. So from a Chinese medicine perspective, all of our therapeutics fall into 5 branches, is what we call it in Chinese medicine, of therapeutic intervention: acupuncture, herbs, massage therapy, diet therapy, and movement therapy. Movement therapy being Tai Chi and Qigong. So that's our field. And in the discussion of the treatment of this disease pattern or syndrome pattern, any 5 of them can be explored. And all of them follow in the same method, which is cool. If it's liver qi stagnation, we want to free the liver qi, the first excess condition. So herbally, Xiaoyawan. Dietarily, lots of tea with mint and citrus peel to disperse the liver. Sour flavored foods with a pungent acrid finish, dietarily. Acupuncture wise for liver qi stagnation, 4 gates: liver 3, Li4, zigong over the uterus, bladder 31, bladder 32 over the sacral foramen, first and second sacral foramen, back of the uterus, gallbladder 34, free the liver qi, Spleen 6, open up the uterus through fascial continuum. Liver 7, liver 8, open up the uterus through fascial continuum. CV4, CV6 over the front of the uterus. Liver 14, gallbladder 25 to disperse the liver directly. Chinese medicine for acupuncture points, we do local, distal, empirical. So the things local that'll affect the things distal on the associated meridian, and then empirical points, points that have just been shown over history to be effective. PC6, spleen 6, LI4. They're not on the regular meridians for this, but they're empirically shown to work very well. So that's liver qi stagnation. And liver qi stagnation, as far as physical movement, as you mentioned, exercise. Disperse the liver qi. It's a stagnation of blood. If we exercise the cardiovascular system and promote blood circulation throughout the entire body, it doesn't get stagnant, and then they don't have the symptoms. Make them exercise. It's kind of funny that you said low libido could be a side effect, because low sex and not having sexual activity stagnates the liver. Having sexual activity frees and moves the liver. People skip and sing and have song and are all happy after. So sex as well as a way of movement to move the liver qi. And then qigong. We got Jade Woman qigong and Daimai qigong. Any of the great tiger, the green tiger, any of the tiger form, dragon tiger qigong forms, any of the dragon tiger qigong genres are great to move the liver. And they even go to the next excess condition, the excess of phlegm, heat disturbing the heart and the mind. I mean, if they're so stuck that they got fire in them, get them to breathe like a dragon and chop off some heads. Energetically, through qigong dancing. There's qigong ways to do it, so they don't have to do it to their friends, family members, or people at work. And then, massage can really work well for PMS. Just having an acupuncture tween-a shiatsu practitioner to move the meridians and to stretch the liver and to promote circulation of blood by massaging the arteries and the veins in the body to get the blood to disperse while tapping the liver. Just physically tapping over the liver while hissing can sometimes free the liver up. Remember, there was one time working with you where I stretched your gallbladder meridian, and your gallbladder peristaltized. It started moving. I'm like, hey, your gallbladder's letting go. You're like, how can that possibly be? I'm like, well, how could you know that even? I'm like, look, it's moving. And you confirmed it the next day with green stools. The bile had discharged. So you can use the meridians to move and release the organs. In the case of liver, let's continue with the second differentiation of excess, the phlegm fire, moving upwards. We got to clear fire, free the liver, drain damp, settle the mind, and get the energy moving down. This is interesting. It's a parallel. Instead of using GABA agonists, we use calcium. Instead of stopping the gate for the calcium to leave and to flood the nerves with calcium, we use oyster shells. We use dragon bones, which is prehistoric bones, powder. We use calcium to settle and to bring down and to cool the body, to slow down the neural impulses. There's really good herbal, Wendon Tong is one of the best to clear heat from the gallbladder and liver. Shen Tia Liu Yin is the banner formula. You can look it up. Dietarily, it's really important with people with phlegm fire to avoid dairy and greasy and spicy food. So it's like, we're talking buffalo spicy wings with an aioli or a yogurt sauce, the absolute worst thing. We got to have things that promote urination that are cool and settling. Oatmeal with mint. Cool, settling, drains fluid downward, promotes urination. Drain phlegm, drain heat. I would suspect, based on looking at the tongues in your area, there's probably going to be a lot of the phlegm fire disturbing the heart shen, PMS etiology. In Mullumbimby, there's just so much damp heat. So you can drain it herbally, you can treat it dietarily. Acupuncture-wise, think of acupoints that tonify the spleen, stomach, and drain damp, because the earth's responsibility to manage water. CV12, CV4, spleen 6, spleen 9, kidney 6 to regulate the yin. And then to drain liver fire, liver 2, liver 3, gallbladder 34, liver 14. Anything, do 14, the great yang, the crossing of the yang.
Yeah.
Do 24 to release yang, pricking the top of the ear. That's the acupuncture methodology. And then for qigong, once again, for the phlegm fire, Get them to sweat, get them to exercise, get them to do yang movement and discharge. The deficiency cases are much different. You know, if you treat the excess cases as though it was a deficiency, like if you tonify the liver blood in somebody who's got liver qi stagnation with blood stagnation, you're going to make them a lot worse. It'd be really important to distinguish, is this an excess or a deficient case? If it's deficient, tonify. If it's excess, reduce. Absolutely imperative if you're going to have a successful outcome. So the liver blood deficiency, tonify the liver blood. Ba Tong, women's 8 treasure decoction. Si Wu Tong, nourish the blood decoction. Shui Fu Ju Tong, any of the blood tonic formulas. And then dietarily, to tonify the blood, eat blood. The Chinese are that way. They'll have blood sausage. They'll eat black bone chicken, oxtail soup. And for the vegetarians out there, beets, collards, kales, dark green, chlorophyll and hemoglobin are very similar molecularly. So anything that's very dark in color, red in color. Beet juice. I read a lot about beet juice and beets as the new medical intervention for PMS and for visual disturbances. It's like, of course, it nourishes the liver blood. Of course, put some celery, some cucumber, a little bit of dill, a little bit of thyme, a little bit of mint, to disperse it, it'll be even better. So dietarily for liver blood, quite simply tonify the liver blood. We've got a really cool, it's called the 4 flowers in acupuncture, bladder 18 and bladder 20. The spleen and the stomach on the back to stimulate the spleen because it generates blood, and to stimulate the liver. So to moxa heavy, bladder 18 and bladder 20. To tonify the liver blood and liver blood deficiency. If they've got liver qi stagnation and you go tonifying the bladder 18, you better grab a helmet and a shield. Got to make sure that it's the right etiology. Don't want to add fire with somebody who's already got liver fire. But if they got liver blood deficiency, you can use a little fire to stimulate the production of blood. Kidney, liver, well, that's enough for the liver blood deficiency. It gives you acupuncture and herbs and diet. It's hard to nourish blood through body work. You can stimulate the organs that produce blood. It helps, but until they have the Lego blocks to build the castle, you need to add blood, either dietary or herbally. I could only conjugate so much blood as a body worker. To make more blood, they need to take some more blood byproducts in. In the kidney liver yin deficiency cases, tonify the kidney and liver yin and free the liver qi, and potentially subdue liver yang. You'll know they'll be liver yang if they've got the distended temples and their head shaking back and forth. That's when it goes in the key part. But if it's just kidney liver yin deficiency, just tinnitus, ear ringing, night sweats, brittle skin, brittle hair, PMS snappy like a branch in the wind, tonify the liver and the kidney yin. Li Wei Di Huang Wan, great formula. 6-flavor Romania tablet, works every time. You can go to Qiju Di Huang Wan to strengthen it, but Li Wei Di Huang Wan is fine enough. Dietarily, this is where the Chinese eat the shark fin soup and the cartilage. They consider that stuff very yin tonifying. If you don't want animal products and don't believe in it, I personally don't support shark fin soup. Lychee, long gone. Watermelon, coconut. You get the idea of thin, viscous white fluid nourishes the yin. Dietarily or herbally. That's a possibility of an option. Acupuncture, it'll help to nourish the yin, but in my experience, it only lasts a few days. If you want a long effect of nourishing yin, you need to take something into the body. And then the last case, spleen, kidney, yang shu. Tonify the spleen and kidney yang. There's herbs to do that. They're all warming herbs, and it's really easy to do that dietarily as well. Let me give you a good herbal formula for those that are interested. Oh, Yoga Wei Wan. Restore the right pill. Great formula to tonify the kidney yang. Want to boost the spleen yang? Ginger, turmeric. Eat warm, spicy foods. Clove. A little too hot. Ginger's enough. A little more red meat and a little bit more sexual activity. The male injects yang qi, the Chinese say, in penetration. And in absence of that, there's not enough yang in the uterus. So without sexual activity, women can end up depleted in yang. The yang comes from the masculine. And without sexual activity, it's hard to replace that yang gene. You can do it dietary or herbally, but intercourse is the natural way to go about it. And by the way, it does lift the serotonin as well. Herbally, to tonify the yang, I'm glad you got that. To tonify the yang, we got moxa over kidney 7, CV4, CV6. Think about tonifying the spleen with spleen 3, bladder 20, stimulating bladder 20, using some moxa over bladder 20. And that's how we would tonify the yang. Once again, the proper differentiation is the key. All right, I think I got that's a pretty good quick whirl through the therapeutics. And negate the emotional physiological effect. It can't be neglected. You know, I mean, just taking Prozac or birth control pills isn't really putting ownership in people and their mentality of how they think and feel about themselves, how they interact with the world, the way they choose their diet, and their approach to life. I mean, if we really want to get to this, we got to talk real. It's how people think and feel. Any one event can be read into a constriction and impaction or to an openness and expansion. And no pill that anyone can take can replace that for a person.
That's so cool. Yeah, it's more than just a pill. I mean, it's overriding it, but it's not really getting down into it.
It's not even overriding it. It's not even addressing the gynecological concerns. It's just addressing the mood-related concerns. And even at that, it's just cursorily affecting the mood through this idiosyncratic psychological mechanism. I mean, it's not, I mean, let alone getting to the biological substrate of the gynecological process in the menstrual cycle and recognition of the yin hormones and how they develop blood and the yang hormones and how they discharge the blood and balancing the yin and yang hormones. We're doing the same thing, herbs or pills, as far as the progesterone and estrogen. You know, the kidney yang tonic herbs build progesterone, and the kidney yin tonic herbs build estrogen. We're affecting the hormones through the herbs just the same. But recognizing the full cycle and how what happens 3 weeks ago can actually affect menstruation today.
That's really cool.
Uh-oh, we blew the pipe.
Yeah. It's okay.
All right. I got to get going. I love all y'all.
Thank you so much.
Next time that we reproduce it.
Yeah.
All right. I just did a close up for everybody.
All right. Thank you, buddy. We'll see you next time. And hopefully we get to cover some other good topic for bring health and healing for people out there in the world.
And to put it out, if people have any subjects they want us to discuss, please email us and let us know.
Perfect. That's a really cool idea. All right, man. You have a great day. I will see you next time.
All right. You too. Aloha.